Today we are going to talk about painful sex. This is something that nobody really wants to talk about, but we are very fortunate to be comfortable as physical therapists to talk about it. So one of my patients, again, we're keeping names confidential here, so we're going to call her Anne. Anne came to me. She was in her late 50s, and she was postmenopausal, and she started having pain with sex. And the pain had been going on for just a couple of years. So Anne told me her story, that her pain began with no known reason. She was married, had had the same partner for 30 plus years, never had really pain with intercourse before, and then all of a sudden in these last few years, pain had started, making it really and pretty unbearable to have intercourse. It was affecting her confidence, it was affecting her relationship, it just made her feel broken. So luckily, her doctor, her OB her OBGYN had referred her to us for treatment, and at the right time. So let me explain a little bit about kind of the history that Anne had, what I found on our examination, and then we'll go into some things that we did to treat it. So again, Anne was in her late 50s. She had been through menopause kind of in her early 50s. So she called herself postmenopausal. She felt like she was kind of done with menopause. Pain had begun a couple of years prior to coming to see me. Her description of her pain was that her pain was right in her vagina, and it was really with only initial penetration. So mostly with painful sex, of course. So that was her biggest complaint, was pain with intercourse. But she also had pain with gynecological exams, and so discomfort was not just alone with sex. So it was really with the initial entry during intercourse. It was also with the gynecological assessments. She described it as burning, like there was an open wound in her vagina. And as she and her husband would continue to engage in intercourse, the pain would slightly lessen, but it would never go away. And it was just not enjoyable to have intercourse because of the pain. When I asked a little bit deeper about her past medical history, I found out that she had had 2 children, both vaginal deliveries, and she had 2 episiotomies during delivery. So her perineal area, right between, tissue between the vagina and the anus, kind of in the middle there, was cut during delivery. She said that she healed well. There was no complications. She didn't have any pain that she could remember following childbirth. So this pain was new, okay, but she had a history of a little bit of pelvic trauma just from childbirth. So we got into the examination process, and what I found on her examination, and by examination, I mean I did an internal examination of her pelvic floor muscles, and I've got my model here, so I'm going to show you just a model of the pelvis and the pelvic floor, so you're going to get a little graphic here. But here is our pelvis, okay, and here are our pelvic floor muscles. And just to orient you, right here is the urethra, here's the vaginal opening, and here's the anus. And all of this around the opening here in red are muscles that are supportive for our sexual function as we were talking about it today. So I assessed these muscles internally. Through my examination, what I found was that especially these very superficial, more opening muscles here were very, very tight, and they weren't moving very well. So when I tried to stretch them, they wouldn't stretch. And when I asked her to try to contract or Kegel and then bear down and try to lengthen her pelvic floor muscles to stretch them, the muscles wouldn't move very much. So there was a tightening and kind of adhesing of the muscles, very specifically kind of down in this lower vaginal region. And what I found, and what my conclusion was, is that because of old scar tissue, likely old scar tissue where she was cut from her episiotomies, that old scar tissue had adhered down, had tightened up over time. And then because of menopause, when we start losing estrogen, we start losing, tissue thickness and moisture in that area. When the tissue becomes really thin and dried, then sometimes this old scar tissue can start to wreak havoc when it comes to having intercourse. The act of intercourse is a stretch of the vaginal tissue and the pelvic floor muscles. So if your muscles in this area cannot stretch, to have intercourse, if they cannot stretch to have a gynecological assessment, if they cannot stretch to wear tampons or, any type of insertion in this area, if they cannot tolerate the stretch, that can result in that burning kind of open wound type pain. And I hear it very commonly. So for Anne, the tissue here just wasn't moving well, and these muscles weren't allowing stretch to happen, resulting in her pain. So once we got down to the bottom of why she was having her pain, then we could treat it. And so we did. We did treatment to improve the mobility of her pelvic floor, the flexibility of the tissue, from the muscle tissue to the scar tissue. You can work on old scar tissue even 30 years later. Okay, so 30 years we're talking. But we worked on the mobility of her pelvic floor and the surrounding tissue. And once we got her tissue better stretching, tolerating stretch better, then her pain resolved. And it was wonderful for Anne. She emailed me back. I checked in on her and she emailed me to tell me that she was so thrilled that physical therapy could help her get pain-free sex again. And of course, her husband thanked me as well. So wonderful things that we can do in physical therapy and pelvic physical therapy specifically for painful sex. I want to share with you some of the potential treatment options. This isn't exactly everything that I did with Anne. But like I said, we work on relaxing the muscles, stretching the muscles. So those can come in various forms of exercises or breathing techniques. Some of the other things that we can use for painful sex are called vaginal dilators. And I've got an example of one here. So this is just a standard kind of plastic dilator, and they come in a variety of sizes. So you start, these are insertable into the vagina, and they can really help stretch the tissue in a very gradual pace. So it helps women tolerate the stretch better. And you can use them to, help your own kind of pushing and pulling on the muscles to help them gain more flexibility too. So they're used to be inserted into the vagina to help increase mobility and flexibility. And they start kind of at a gradual pace. Usually the kits kind of follow a number of dilators. They can range from 4 dilators to some kits have 8 dilators. They come in a lot of different varieties and sizes and styles. So this is just a very simple kit that we commonly recommend to our patients because it's pretty cost effective and it's pretty well used. But these are dilators, and these can be really key with helping with painful sex. So these are things that we'll instruct patients in using, help them use them here so they get comfortable with them, and then they start using them at home. So these are a really great option for women who have pain with sex. The other things that I did with Anne is I did a lot of soft tissue work on her pelvic floor muscles. So she was sent home with some exercises and tips to do on her own, but when she came in to see me, I did a lot of hands-on treatment to her pelvic floor muscles directly to help increase the flexibility, decrease the pain, increase her mobility on her pelvic floor muscles. And she did that. She tolerated that really, really well. So it's not a one-size-fits-all treatment for pain with sex. There's lots of different directions that you can go with treating it. Everybody's pain is different, but for Anne specifically, just getting any relief and what felt like just a random onset of pain was hugely helpful for her. And she did great and is still doing great, which of course we love to hear. So you're not alone if you're dealing with postmenopausal pain with sex. If it feels like it's something that just came up out of nowhere, this is something we hear a lot. There is treatment available. So please, please, please do discuss with your primary care doctor, your gynecologist. Don't be afraid to talk to them about your painful sex because you should not be suffering in pain and just trying to deal with it. Okay, it shouldn't be something that a doctor tells you, drink another glass of wine, try some more lubricant, you'll be fine. Okay, there's more that we can do for that. I hate hearing that when my patients say that their doctors told that to them. Because although lubricant and wine can certainly help, it's not going to be the thing that fixes your pain all the time, okay? If you're looking for more suggestions on how to ease pelvic pain, we do have this ebook on our website, so I'll link it below, but 11 tips for easing pelvic pain. Lots of great tips in here that we share, all for free. So it's not specifically for pain with sex, but it does talk about it, and it does show you kind of some common diagnoses and potential treatments for helping relieve pelvic pain. So if you're questioning anything about your pain in your pelvis, even if it's not just painful sex, but you have pelvic pain of any kind, this is a really great resource for you, and you can just download it off of our website.